Hello, how you going? My name's Lucas Bayra. I'm a surgeon at Queensland Veterinary Specialists. We've put together this short video and presentation for the purpose of explaining to prospective clients and those clients who have already booked their pets for surgery the expectations at home and the process following surgery at Queensland Veterinary Specialists involving total hip replacement. So just to give you a bit of an outline of the journey, we don't perform surgery on the day of consultation, but instead the day of consultation is designed as a opportunity to identify patients that are suitable candidates for the surgery. Depending on your schedule and your pet's fasting status, we may obtain our preoperative radiographs on the same day. Whilst many pets come with x-rays already have been obtained at their local vets, these are not appropriate for what we need when it comes time to obtaining our calibrated surgical radiographs. The x-rays that are taken at your local vet are more often than not great for the perspective of diagnosis, but we need to be able to measure the implants that we're going to use within the millimetre, and there are some particular projections that we obtain in order to allow us to do that accurately. And then surgery is scheduled at some time point later. It might be the following day, or more often than not, it's the next week or a few months later. If your pet's had radiographs and surgery has been delayed between 3 and 6 months, we may ask you to come back in for an additional set just to make sure that there's been no change in the status of the hip, particularly for young growing animals, just to ensure that the bone dimensions remain similar. On the day of surgery, we expect pets to remain at the hospital for, on average, 2 nights. Some pets go home the day following surgery, some may stay more than 2 nights, but on average, it's going to be a 2-night stay. By the time of discharge, we'll discuss with you in greater detail the recovery expectations, but we will then expect you to return about 2 weeks later for the first clinical review. We have a chat about progress, make sure there are no concerns. We'll do a wound review, take out any stitches that may require removal. And also, it's another opportunity just to check base about how you're going and what the expectations are moving forward. About 4 to 6 weeks from that review, or 6 to 8 weeks from the time of surgery, we're going to organise the initial radiographic post-operative assessment. And if everything's going well at that stage, life can somewhat return to normal, and we will recommend sort of annual or every 2-year monitoring radiographs, depending on the pet situation. On the day of surgery, we ask you to present your pet nice and early, between 7 and 8 a.m. There's no breakfast to be given on that day. Water is absolutely fine. We don't want them coming dehydrated. Unless there's an absolute need, and this has been discussed with your clinician prior to the day, please don't administer any medication, but please bring with you any medication that your pet is receiving at that time. And if you have the opportunity to bath them in the days leading up to surgery, that can be very helpful. It reduces the risk of identifying sort of skin issues that may be present and might result in delaying of the surgery. So on the day of surgery, surgery is either performed in a morning or an afternoon session. You will be called afterwards. Most pets we're prepared to keep for about 2 nights. So if it's a Tuesday surgery day, we're expecting them on average to go home on a Thursday. Some pets might go home earlier or later, depending on individual circumstances, but on average, it's about a 2-night stay. People are very worried about what their dog's function might be, and a couple of these videos just sort of highlights for you how well these dogs are walking very soon after surgery. So this is young Boomer. Boomer had a fractured femoral head that was operated with a micro total hip replacement, and this is the afternoon, having had surgery in the morning, and you can see that Boomer is walking albeit with sling support, mainly for safety purposes, but is consistently weight bearing and able to walk on that leg, within hours of the surgery. And a lot of that comes down to our technique and our pain management protocols as well. We're very proactive with ensuring that pets are given the right and the best pre and post-operative pain relief that we can offer. Now, on the day of surgery, we will call you at some point after. Sometimes this is quite late in the day owing to the surgery schedule. We'll let you know how it all went, identify any concerns that might have been present on the day, but most importantly, just to let you know that your pet's okay. Now, if you haven't heard from us, it doesn't mean that we won't call. It just means there hasn't been that opportunity. If you're concerned and worried and waiting by the phone, you're more than welcome to call and chat to the team on reception, and they can give you an update on your pet's progress. And then we'll give you an update the following day, just to let you know how everything has been overnight and in the morning, and then we'll make a tentative time for discharge. And then the following day, so 2 days later, we'll ring once more with another update. And if everything's looking ready to go home, we'll confirm the timing at that point. On the day of discharge, we'd recommend that you bring a sling. A Hessian shopping bag from Coles or Woolies is fine, but if you can organise a commercial sling, that's also very helpful. We do stock some within the clinic, but they're not always in stock on the day of surgery. So we recommend you prepare this beforehand. Slings are really important for use on any slippery surfaces. The clinic's floor is inherently slippery owing to its cleaning properties. So anytime you visit the clinic with your dog in the early post-operative period, we'd ask that you use it within the hospital floors. On this day, we'll go over written discharge notes with you. We'll explain the medication expectations. We'll take you through the post-operative x-rays. And it's more than appropriate to be lifting your pet in and out of the car. If you need any help with that process, we're here for that purpose. A lot of people ask about ramps. Ramps are kind of a double-edged sword, particularly if the pet's not used to them. So as a general rule, we try and avoid ramps in the very early post-operative period. But, a few weeks, a few months later, they're a great idea for getting your pet safely in and out of the car. So this is Tori, an older German Shepherd. This is sort of a day and a half post-surgery. So you can see a sling's being used, but Tori is independently moving. The purpose of a tail bandage is just for cleanliness reasons in the hospital. So Tori's not walking, entirely comfortably, but there's confidence within that leg and an ability to weight bear on it quite consistently. So that would be our typical expectation for pets, 1 to 2 days post-operatively. So that's kind of what you're likely to be experiencing when they first come home. Now, this is the stuff that really gets people worried. But it needn't be that stressful. You just need to have a plan in place, and we can help you with your individual circumstance, designing a plan that works best for you and your pet. But the best way to think about it is we've got the first 6 weeks, which need to be really strict, and then we've got the second 6 weeks, which need to be sensible. So during the first 6 weeks, there are some non-negotiables, okay? One of the non-negotiables is that we need to be limited within a confined space, such that there's no opportunity for your pet to access stairs, get speed up to run, or actively jump off anything that's elevated. So for some dogs, a crate like pictured is the best way to accomplish that. For other pets, it's just a small room, so a study, a laundry, a garage, a spare bedroom. That all is appropriate. Now, ideally, we need to avoid slippery floors. And one of the challenges in Queensland with all the polished wood floors is that there's a lot of slippery surfaces. So if you recognise that within your house there's slip risk, there's a few ways to manage it. One is to put down non-slip flooring temporarily. That's easy enough to achieve if you can isolate a room to their recovery. Somewhere like Bunnings will sell the jigsaw rubber mats that work quite well. Some people will use rugs. Just be conscious that rugs on a slippery surface can be slippery. So put something non-slip between the two surfaces. All outside activities done on a lead. This is a non-negotiable. Even if your dog's the perfect dog, well-behaved, good recall, it just takes one moment of excitement, a possum, a cat, a backfiring car, for them to be startled and run off after the noise. So really important that all toileting is done on a lead. And then every week, the expectations will slightly change. For the first 2 weeks before your first review at the hospital, we're expecting that pets are just going outside for the purpose of toileting. So that can be twice a day, 5 times a day, 10 times a day. It doesn't really matter, but it needs to be on a lead at all times, and just for the necessary period to do business and come back inside. So a few minutes up to 5 minutes at a time. Once the first review at 2 weeks is completed, then you can start to ramp up some more activity. So we can start to go for 5 to 10 minute walks once or twice a day. A few weeks later, get up to 10 to 15 minute walks. So that's the strict period. That's the non-negotiable stuff. In the second 6 weeks, we just need to be sensible. So pets can resume home freedom. There's less of a need for strict confinement. Can start to navigate stairs within reason. Can do as much walking as they want to do. So get them on a lead, go for a 20, 30, 40-minute walk, that's fine. But during that second 6 weeks, it would be wise to avoid really boisterous play. So no running at the beach, no dog parks, nothing where there's a risk of having a big tumble or being knocked over. So just to remind you of the process, we've got the day of consultation and the preoperative radiographs. We've got the day of surgery. Pets stay with us for 1 to 2 nights afterwards. They go home. They come back about 2 weeks later. The next critical review is 6 to 8 weeks after surgery. That's a day visit. So they're going to stay for the day, be sedated, have some x-rays. And then every 1 to 2 years later, we would recommend a follow-up monitoring series of x-rays. What are they likely to look like through the recovery period? This is lovely Rummy at 6 weeks. Now, this is stretching the friendship when it comes to being on the lead. When we say being on the lead, you've got to be connected on the lead to a human being, not just on the lead in an open field. So, but you can see that Rummy's very comfortable at 6 weeks, getting around, almost normally. This is little Mishka. So cats and small dogs routinely have hip replacements for particular needs. And you can see great range of motion, really happy, affectionate cat, and getting around almost normally. So those monitoring radiographs, just to finish up, they're done between 6 and 8 weeks, depending on individual circumstance and the clinician that you've been communicating with. And we obtain these. They're really important to guide ongoing activity and identify any concerns. Okay, they're a day visit, usually are done sort of within a few hours. They must present fasted, so no breakfast, but water's fine. And then at that stage, as we mentioned, sensible return to lifestyle. So increasing patient freedoms are possible. And then we do recommend annual radiographs thereafter. Okay, I hope that's been useful. My name's Lucas Beyrer, here at Queensland Veterinary Specialists. And if you have any questions, you're welcome to get in touch with the clinic.